Welcome back to Patch. I'm Chris,
I'm Sawyer.
and today we're going to be talking about the effects of secondhand smoke during pregnancy. A new WHO report, Tobacco Control to Improve Child Health and Development, calls for raising awareness among parents about secondhand smoke and smoking during pregnancies. Exposure to tobacco smoke has a devastating impact throughout childhood and adolescence, starting from conception. Exposure of unborn children to tobacco and smoke, or secondhand smoke, is linked to birth defects such as stillborns, preterm births, and infant deaths. Maternal smoking during pregnancy is linked to doubling the risk of sudden infant death and birth defects, while exposure to secondhand smoke during pregnancy is linked to 23% increased risk of stillbirth and 13% increased risk of congenital malformation. Secondhand smoke kills around 1.2 million people every year, and 65,000 of these people are premature and preventable deaths are children and adolescents under 15 years old. Children with caregivers who smoke are almost 70% more likely to try smoking by the age of 15. Exposure to secondhand tobacco smoke affects children's survival, health, and development before and after birth, said Dr. Bernadette Dolmans, Unit Head, Child Health and Development at the WHO Department of Maternal Newborns, Children and Adolescent Health and Aging. There is no safe level of exposure to tobacco smoke. It seriously harms the health of a child and may drive the child later to engage in tobacco use, which will increase the risk of serious health harms through life, she said.
Tobacco use and exposure to secondhand smoke during pregnancy also hurts babies. Exposure to secondhand smoke during pregnancy is particularly relevant to many low and middle income countries, where few women smoke but many men do. In addition, use of smokeless tobacco during pregnancy also increases risk of stillbirth, preterm birth, or having a low birth weight baby.
Children living with smokers are at a greater risk for lung disease and early mortality. Children that live with parents that smoke are at a greater risk for bronchitis, pneumonia, and other respiratory infections. They are more likely to acquire and be hospitalized for asthma and develop middle ear disease. Moreover, they are at increased risks of dying before their 5th birthday. The report highlights that children exposed to tobacco smoke early in life are also experiencing behavior problems and do less well in school. It goes on to state that children who experiment with smoking are more likely to go on to become smokers as adults, thus putting them at an increase of premature death and disease later in their life.
A smoke-free generation is within reach. Tobacco is a child's rights issue, and tobacco control is a cost-effective intervention for child health. 62 countries globally have adopted comprehensive smoke-free policies, improving their child's chances of a healthier future. Creating 100% comprehensive smoking-free policies result in greater benefits, especially when those policies are adequately enforced without exceptions. No tobacco with the WHO Department of Health Promotion. This, along with accelerated implementation of other key measures to reduce tobacco use under the WHO Framework Convention of Tobacco Control, are key to achieving the SDG 3A target. Societies are now increasingly demanding smoke-free outdoor spaces, such as school grounds, playgrounds, outdoor dining areas, parks, and beaches, as well as indoor private places, such as common spaces in buildings and condominiums and cars, to protect people from exposure to secondhand smoke, including pregnant women and children.
This has been the effects on prenatal tobacco and secondhand smoke. Have a wonderful day.